It was a Friday afternoon. Tan Tock Seng Hospital was buzzing with activity. The busiest part of the hospital seemed to be the accident and emergency department. There were many patients waiting to see the doctors. However, there were a few emergency cases. The non-emergency cases had to let the doctors attend to the emergency cases first, so they had to wait longer. At about 3 in the afternoon, an emergency case was brought in. The patient was a middle-aged woman and she was unconscious. She was immediately wheeled into the operating theater. There was blood on her cheeks and blouse. Some police officers and 2 teenage girls had accompanied her. The teenagers were the woman's daughters and they were sobbing quietly. The woman was a victim of a robbery. She had been stabbed in the stomach and she had lost a lot of blood. Immediately after the woman was wheeled in, the next emergency case appeared. It was a work-related accident this time. The man looked fine, but he had 2 of his fingers from his left hand chopped off while he was trying to repair some factory machinery. In fact, he was clutching his chopped-up fingers, which had been wrapped in tissue, in his other hand. He was hoping that the doctor might be able to attach his fingers back. The waiting patients were getting a little restless. It seemed like a busy afternoon for the accident and emergency department, and they might have to wait a long time. True enough, another emergency case came in a few minutes later. This time, it was a little baby. The baby lay unconscious and the mother was sobbing anxiously. The baby had fallen from its prom and knocked its head on the floor. There was no bleeding, but it was unconscious. It lay in a dangerous condition because it might be suffering from internal bleeding. The last emergency case on that Friday afternoon was an old man. He had a sudden stroke and he was paralyzed suddenly. His children and grandchildren had all followed the ambulance in taxis. They were discussing quietly among themselves about the old man's condition. They were shocked that the old man was perfectly normal and able to move 1 minute, and then was paralyzed the next minute. Fortunately for the waiting patients, the old man was the last of the emergency cases for the afternoon. Soon, most of them got their turns to see the doctors, and the accident and emergency department was uncharacteristically quiet for a little while.